Hi, guys. Thanks for joining me to Janetta Jane Transformations podcast. Today, I'm going to be interviewing an amazing guest, Dr. Sarah Michaud. She's a psychologist who specializes in areas of addiction and recovery from addiction and codependency. So, who's this for? This is particularly great for anybody who has challenges setting boundaries, speaking up for their needs, or tolerating emotional discomfort or accepting emotional discomfort when perhaps it's time to move on. So, anyone interested in self-discovery, recovery, and personal growth, this podcast is for you. I'll be joining Dr. Sarah Michaud in a moment, and I just wanted to introduce this for now and get the recording rolling. Thanks for joining me. You can find more of my podcast stuff on YouTube and a lot more on BitChute and Rumble. So we'll stop there and we'll just wait for Dr. Sarah to join us. Thanks, guys. Hi again. I just wanted to mention this is Dr. Sarah Michaud's fantastic book, Co-Crazy. I've been loving it. It's got great humor, storytelling, and raw authenticity that will bring you right into the heart of Dr. Michaud's struggles and wisdom and help you on your own personal path. So we'll get going with the rest of the interview in just a moment. Thanks for being here. Excellent. Hello, everyone, and welcome back to Janetta Jane's podcast. I am here interviewing Dr. Sarah Michaud, and I pronounce it the French name, Michaud, instead of Michaud, or however else other people might pronounce
Perfect.
it. And we are going to talk about recovery and healing and codependency and all sorts of amazing topics. So thank you for being here. Dr. Sarah Michaud is a psychologist. She also has an amazing history. And as I mentioned to you guys in the brief intro I did, this book is a much get co-crazy. If you struggle with addiction, if you struggle with codependency, there's so much food in here. And so we'll bring it back to Dr. Sarah and introduce her. You can introduce yourself any more than what I may have already done. Um, but maybe just before we begin, we'll do a little grounding opening. And
Okay.
so I just, anybody who's watching, so you're fully here, maybe just noticing the weight of your body in your chair, the rise and fall of your breath, allowing you to arrive fully into this conversation. Maybe feel your feet, become aware of your body, take a couple of deep breaths in and nice slow exhales, and get ready for an amazing talk as we embrace this beautiful topic of recovery and self-discovery together. So thanks for being here, everyone. And particularly a big thank you to Dr. Sarah. So I'll leave it to you. Go ahead and
Oh
introduce
my God.
yourself and share a little bit of what co-crazy means to you, which is the name. And just before you came on, I gave a brief introduction about my excitement for meeting you today. And I showed your book and just told the audience to get ready for something amazing. So,
Oh,
uh,
you're so sweet.
yeah. So
So
let us
much for
know how,
having me and reaching out to me.
yeah.
Yeah, I mean, it's funny because a couple things. One is the title. I know certain people have had a problem with the title because we use the word crazy. And I use the word crazy. And I mean, I was like a women's studies major in college. So, I mean, I get it. I get people's association or trouble with that associated with women. But this
Mm,
is why I called it Co Crazy, is because every patient that came in and was struggling with codependency or being a dysfunctional family or being an addict or being married to an addict or being with someone who was seriously depressed or whatever the case may be, or growing up in it, they felt crazy. And that's the thing that codependency does. It's so hard to see how your environment and all those interactions with people who are struggling or unwell or in an addiction or in narcissism or whatever, it's so hard to see that, wow, this is really happening and I'm being affected and I have to take responsibility for how I'm being affected. But it's so hard to figure out what's going on. And part of
Mm.
that issue is because if you know addiction or you grew up in addiction, the quintessential component of addiction is denial. And it's people
Mm.
don't talk a lot about the mental components, which are really cognitive concepts, right? Denial, minimizing, rationalizing, romanticizing. And I remember, growing up, my mother was an alcoholic, and I would come home from school. And in the later years, I would say, Mom, you've been drinking. And what would she say? She'd say, No, I'm not. And so when a kid grows up in that and they
Mm.
see a certain reality, but it's being told to them that that's not reality, you
Mm.
feel crazy. And
Mm.
so that's why I'm going off on the title, but that's why I called it that. Because for many years growing up, I would feel like, what's wrong with me? And I know a lot of
Mm.
people with codependency say that, like, what's wrong with me that I keep picking these relationships? Or what's wrong with me that I'm angry all the time or I'm anxious all the time and I can't seem to speak up for myself?
Mm.
And really, it's just doing a deep dive on what patterns developed over time as you grew up and being around and learning to be around healthier people so you can trust what people are telling you. And
Absolutely.
just lastly, Jeanette, I will say that, I do a book. We call it the Boozeless Book Club. It's once a month. And I do it with actually a gal from out your way. Her name's Amy Liz Harrison. She has a podcast. And we were talking about codependency recently. And she said, codependency is so woven into the fabric of who I am that
Mm.
I literally can't tell if what I'm doing is codependency or what I'm doing is just me. And
Mm.
that's really the thing that's so complicated for your audience is people will say, well, this is just who I am. I'm just a nice person. But they don't realize that a lot of those behaviors are coming from fear or coming from their past and that they
Mm.
really aren't choosing it. Okay, I said a
Mm.
lot.
No,
I
that's
said a lot.
absolutely wonderful because this is a big topic, and that safety blanket of denial that we grow up with has to be in place because we love our parents. So to face that,
Yes,
the truth is to think they don't love us. And as kids, right,
yes,
we come in needing our parents' love and needing to be authentic, but the authentic goes right out the door because we can't be authentic in these traumatized systems.
yes,
So it's finding our way back to our authentic selves through all the pain
yes.
to get to that. So your book is amazing for that. How did your personal experiences with codependency and addiction shape your approach to psychology and helping others?
Well, when I went to graduate school, I think I had, I don't know, maybe 15 years of recovery. I'd have to look back. But I got sober when I was 24. And so I got sober at a young age and
Mm.
being around 12-step programs and recovery. And then I went to graduate school and I worked at the counseling center there.
Wow.
And I just thought to myself, I'm so fascinated by human beings and why we do the
Mm.
things we do
Mm.
and trying to look at and figure out, geez, what is this addiction thing? Why do we feel like we need substances? And I often say, I just did a workshop with a gal. Oh my gosh, I wish I could remember her name right now. She's from Alaska, but she does a lot of trauma workshops on somatic stuff. And she was on this podcast I listened to, and she really frames all
Mm.
diagnoses in categories of your responses to what's happened in your life. Like
Mm,
she does not pathologize. And that's the way I've always thought, except for of course your brain or your genetics. But so many of our behaviors, I think, are just courageous because they're responses to what was happening. If I
absolutely.
was ignored and neglected and I started acting out to get attention, that's a normal response to what was happening to me.
Mm,
Now
for
someone else
sure.
would diagnose them with oppositional defiant disorder or something. And I'm saying it's all on a continuum. It's not like nobody has severe mental illness. Obviously, people do.
Sure.
But so many of our behaviors are pathologized these days. I mean, when I got
Absolutely.
sober, I could have easily been a borderline personality disorder because I had no ability for intimacy. I was angry a lot. I didn't have a sense of self. I had an addiction problem. I mean, I fit like half the criteria, and a lot of women do, at
Mm,
traumatized. And so I just see us as looking at all these behaviors, thought patterns, how we deal with our feeling states as ways we've coped. But now, as adults, it's really looking at what's working and what's not working. And it
exactly.
usually shows up in relationships or avoidance
Yeah.
of relationships. Yeah.
Exactly. Exactly. Beautiful. Was there a pivotal moment for you, or maybe more than one, where you knew you needed a new path for yourself, like either the recovery or the codependency or
Yeah. I mean, I really bottomed out with drugs, and I thank
Mm,
God for the drugs because I probably could have drank for like 10, who knows how much longer I could have
right.
drank for. But I'm really grateful that, drugs cost a lot of money. You start getting involved in the legal system, you
Yeah.
bottom out, I think, more quickly. So that's what happened for me to get sober. And then the codependency. I mean, I was 10 years sober and I went to treatment
Mm,
because I was feeling like I couldn't function in relationships and I
mm,
was still acting out. I was acting out sexually with men. I was still seeking love in all the wrong places.
mm,
And so I was sober, but I was still being driven by my past and by my fear. And so that was a big turning point when I went to treat. I hadn't relapsed. And then I started getting involved in Al-Anon and codependency work. And two things were really significant that I did. One was, did you ever hear of the forum or the S training? It was
yeah.
like years ago. Okay.
Yeah. Yeah. I
So
did the
what,
pursuit of excellence and the wall, similar
yes.
thing, right?
Yeah, so some of that work I remember doing like in the 80s. I was sober a couple of years. And that was really profound for me in the sense of we're all the same. I mean,
Mm,
just that experience of we all are afraid, we all have feelings, we're all trying to do the best we can. And that just having that realization was really eye opening for me
mm,
and broadened my whole perspective about human beings.
beautiful.
And then I was going to tell you about the second one, and then I'm not going to really remember it right this second. So the S training, and I've done tons of like workshops, trainings over the years that have all helped me. And I got into Al-Anon when I was probably 20 years sober and started looking at all the codependency behavior and the relationship stuff. And that significantly helped me. And I'll remember the other one eventually.
Yeah, perfect. Well, I just want to
Yeah.
put something in for Al-Anon too. Having been in 12-step programs for myself for many, many
Yes.
years, I loved Al-Anon because it dove into life. Instead of just talking about how
Yeah.
long you've been sober or when you last ate
Yes.
sugar or whatever, it was about the
Yes.
things in living, the living problems. And that's where we change is the day-to-day
Yes.
living where we show up and do
Yes.
our best.
Yes.
So, um,
Yes.
and a lot of
Absolutely right.
people confuse this whole kindness with niceness. But, the difference between kindness and co-crazy patterns, sometimes people don't realize. Can you talk a little bit about that? Because I think this is profound.
Yeah, I mean, I think if you're a woman on the planet, you were brought up to be codependent. I mean,
Yeah.
I maybe not the younger kids now, but yeah, if you're a woman, I had four brothers. I was the one cleaning the table. I was the one cooking the chocolate chip cookies for people. I was
Mm.
the one taking care of my father. I mean, I was the one that was focused on everybody else being okay before I was okay. And I think tons of women are brought up like that. And again, is it good to be a kind? I mean, I'm a kind person and I'm a nice person.
Mm.
And I needed to learn how to speak up for myself, how to set boundaries. And also, I learned that when you're in relationships, if you're, and I'll talk about fear stuff too, if you're driven by not upsetting your partner
Mm.
or, not making them mad at you or not abandoning you, and you're coming from behaving in a way to avoid certain things in the relationship, you're not being honest in your relationship. So,
Exactly.
how can it be a fulfilling, honest relationship if you're actually not able to be yourself? And
Mm.
again, I think so many women don't even realize they're not being themselves until
Absolutely.
10 years into a marriage and they just wake up enraged one day because
Yeah.
anger is the thing. And
Absolutely.
I did a video for Therapy in a Nutshell. The woman, she's got this huge following on YouTube. She has a mental health YouTube channel called Therapy in a Nutshell. And I did a video with her on the connection between anger, repressed anger, and anxiety. Because I think
Mm.
for a lot of women, they might feel anxious, but they can't recognize that they feel angry.
Mm.
And I think a lot of that comes out in depression and anxiety. So,
Mm.
anyways, yeah,
Absolutely. Absolutely.
yeah,
That was a big one for me that's taken a
yeah,
long time. And sometimes now I still journal and just go back into old stuff and just F
yes,
that, blah, 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 things I couldn't
yes,
say out there, but just to kind of release it because for so many years I held in that anger and it just kills you in the long run.
yes.
It comes out
It
some way in the
does.
end.
Did you ever read Dr. Sarno's book on
Oh,
that? He was
absolutely. The
right.
mind-body connection. I'm interviewing
And
somebody
like it's
about
all
that
about
next week.
anger.
Yeah, he's
That's
great.
right. I mean,
Yeah.
I was so happy when I saw that because I really believe that. In fact, I wrote an article for, oh, it's a pain magazine. It's called I Pain. And I talked about the connection between codependency and chronic pain
Yeah.
because of the anger. And you would know more about this because of your body stuff,
Yeah.
but the repression, the chronic tension, and the ultimate pain and things that we don't know about. And a lot of it, those repressed feelings, like we've been talking
Absolutely.
about.
Absolutely. I'll
Yes,
have a great example of this. Last week, I went to visit my
please.
parents. They're both old and sick. My mom is great, but definitely narcissistic traits. As long as she's getting everything the way she wants, she's wonderful. But boy, the
Yeah.
second you don't give her what she wants, uh-oh. Well, it was a really tough day. And my dad's struggling with Alzheimer's. So there's a lot of
Oh,
family stuff and a younger autistic sister who I'm kind of in charge with, because they
wow.
can't do it anymore. So there's a lot of things that I'm saying no to now and trying to delegate to my
Yes.
siblings who don't live as close, so it's harder. But anyway, I was coming home from this very difficult day with them, and I reached out to my one sister I'm closest to, and I just started to tell her about the day. And she just, I
Yes.
can't hear this. She started getting triggered and she hung up. She said, I gotta go. I can't listen to this because she gets so triggered by the family stuff. Then I get an hour of traffic going home. The traffic is
Oh my
horrendous.
gosh,
By the
Janetta.
time I get home, and I shed a couple of tears on the way home, and then I just kind of blocked it. I can feel all this turmoil. Then I get in, and all of a sudden I realize my hand hurts. I hadn't done anything. I have hand pain sometimes after a big weights workout, and all of a sudden I
Yes.
went, that is so weird. I've done nothing. Where is it? And I went, oh my God. It was the first time I was able in myself to really see Dr. Sarno's wisdom coming true in myself, even though I'd studied it and I'd talked to others about it. It was like, wow. And as I started to
Yes.
do the journal speak, which Nicole Sachs, one of Dr. Sarno's pupils that is now
Yes,
doing a lot of work with that, I started doing that journaling and the hand pain went away. The next day it was completely gone. And I
amazing.
just went, yeah, I think that is just a huge thing.
Yes, yes,
Yeah, you talked
yes.
about relationships, how this often shows up. The relational trauma that we have can often only be healed in relationships. So in everyday relationships, what are some of the subtle ways that codependency can show up in people that they often miss?
It's, yeah, okay, that they often miss. I would, well, one thing is saying yes when you want to say no. I mean, that's just a
Mm,
basic one, right?
mm,
And it happens all the time. And I am not totally cured. I mean, I literally had an experience. This was like around December. It's the craziest thing. But my sweetheart loves fancy food. And I'm like, I could have cereal for dinner. I mean, I'm just not that way. So,
yeah.
but
Oh,
he's like, and it was his sober anniversary. So
oh.
I had this idea to go to this kind of fancy food store and have her make up this basket. And I got, this is going to sound really benign, but it was so significant to me because I think I'm doing pretty well with the codependency recovery. So I go in and I ask this woman, could you make up this basket? I wanted just a little small basket, maybe some caviar and crackers or something. I've never even eaten caviar. Okay. So, so she comes out and she holds up this enormous basket and she says, is this okay? And what came out of my mouth? Yes.
Sure.
And I like, it was the
Oh.
weirdest thing because it happened so quickly. And so many things
Mm.
went through my mind at the same time. Oh, I'm bothering her. It's busy in here. I don't really know the foods to pick. She can do it. But I am telling you, on the drive up to meet him with an enormous basket in my back seat that didn't have half the, it didn't even, she put a bunch of smaller stuff in it because it was a big basket. So I didn't even get what I wanted. And I was so enraged with myself. Like, why did I do that? And
Mm.
so I think to myself, those examples, this is why I have my little YouTube channel and I do podcasts because if it's hard for me, and I've been studying codependency for like over 30 years, I'm in recovery. I'm just about to celebrate 42 years. I
Amazing.
have been a psychologist. I mean, if it's hard for me, like how is the average human being even going through life asking for what
Totally.
they need?
Totally.
And
Totally.
that's the mantra. It's like it's so amazing. And I did a deep dive on it and looked at it and saw like, God, I was afraid of what she was going to think. I was having shame being in the store. Like there were so many variables.
Mm.
But one of the tools that we talk a lot about, and we talk about in my groups too, is that the mantra is, what do I want? What do I need? What do I want? What do I need? What do I want? What do I need? Because when you're codependent, you're always thinking about what they want. So if you have
Mm.
a child or a husband or a wife or employees or best friends, someone will ask you, gee, where do you want to go for dinner? And your immediate thought is, what is my friend? Where does he want to go? Where does she want to go? The
Mm.
automatic thinking is not internal. Where would I like to eat tonight?
Mm.
And then even expressing what you want or need is a whole other thing. Like you
Absolutely.
can know, but then why don't we say it? Why don't we say, geez, I'd like to have Italian tonight? I mean, this is a simple example, but it's such a great, they're small examples, but if it's hard to pick a restaurant, then how do
Mm.
you pick, how do you say to your husband you don't like that house you just wanted to buy, or you, or
Mm.
where your kid's going to go to school, or sexual things? How do you
Mm.
speak up in that arena?
Absolutely.
How do you speak up with your partner on things you know are going to be hard for them to hear? I mean, it's amazing that people can have intimate relationships. And you're right, because when you say, I've been in this relationship now coming up on 2 years with a man I met online, and I've been single since like 2016. So
Wow.
I had taken a big break. I raised my son. He went off to college. I started thinking, like, geez, I wrote the book. And then I'm like, maybe I'll give it one more chance.
Ah, good for
And
you.
I'm right. But the crazy thing is I'm thinking I'm cured. The minute I get in that relationship, my codependency comes immediately back because when you're not in an intimate relationship, it doesn't get activated as much.
Absolutely.
But the minute you get in an intimate relationship, all those old mother father stuff gets triggered. Anyways,
Oh, for
yeah.
sure. And getting back to that, how do you think that family dynamics, childhood wounds, and inherited patterns feed into these cycles? And I'll just touch on the last point you were talking about.
Please.
I've spent a lot of time single, far too much time because I'm so
Me too.
comfortable in my single life. It's like, it's so easy. It's so fun. I
Yes.
do what I want when I want. I live alone. It's like, invite someone in, tell them when to go. You know,
I get
I
it.
mean, I have an adult child who I'm super close with because I was a single mom with her from the age
Yep.
before she started kindergarten. So way back when.
Got it.
And this is where I'm looking at some of this codependency, both of us with
Yes.
each other,
Yes.
but particularly me, because I'm the mom. She should be allowed to
Right.
come to me, and I need to be able to, have other outlets. But when you're that
Yes.
fused for a lot of years, that's the area of my life where I notice more codependent patterns can come up.
Oh,
Ah, and for her too. And she makes it very clear because she's also a clinical counselor, just finishing her master's now. And so we talk about all this stuff and it's just great. But these family
yes.
dynamics and these childhood wounds and these inherited patterns are programmed into us. So the
Yes.
codependency is just a natural unfolding of relationships.
Yes. Yeah. I mean, I think a couple of things. Oh my God, we could do a whole hour on parenting because I have a whole thing about
I'd love
codependency and
to.
parenting.
I would
Oh
love
yeah,
to.
because I mean, I'll give you a great example. We are very similar. I mean, I left my son's dad when my son was 6 months old. And
Wow.
then I got remarried when he started kindergarten. And then that lasted for 5 years, and then that person relapsed. But anyways, he and I very close, just like you, because we spent most of our lives alone, really together. So I sold my house. He went off to college, blah, blah. He came back. I live in a 600 square foot little carriage house that I love because I didn't need a big house anymore. I live in the woods. I love my alone time, just like you. So a relationship ended and he said, can I stay at your house for a while? And I'm like, okay. But a while ended up being months. I mean, this place is so small, we can't literally make phone calls without going outside because we can hear everything the other person is saying.
Wow.
So a year ago in December, and this was literally, and I know you'll get this was literally one of the most painful things I've ever done. He's
Mm.
24. He needs to be out on his own. And he was in a stuck place. And I sat down with him and I said, Bud, you need to move out. And he was like, you know what? You're right. You're right. And I said, I love you. I would do anything for you. I'll help you in the transition, but I got to live alone here. I mean, it's tiny.
Mm.
And it was so hard
I
because
bet.
I didn't want to. This is the thing with codependency, also, that people don't totally get
Mm.
is when you're being codependent, you're not actually helping the other person.
No,
That's the key, right? We
absolutely.
think we're doing it because we're afraid to upset the other person, but we're not. We're doing it because we can't tolerate our own feelings about setting a limit or asking for what we need. And so I knew that I was keeping him stuck. And, he just came here over the holiday. He lives in Cambridge now, which is only like an hour away. And he said, it's been a year. And I remember the first couple of months, he was calling me all the time because he didn't know anybody. And now he has an entire life there. And
Oh.
I would have, because of my own inability to maybe set limits with him, I would have kept him stuck.
Mm.
So I mean, that's the other thing with codependency. It not only affects us, it affects all the people we're being codependent with. So
Absolutely.
that's a huge one. Yes. And
It
and I will just say kids are the hardest. Okay?
Kids
So
are the
just to
hardest.
validate you, kids are the hardest. Yes.
Absolutely.
I
Absolutely. Because the
mean,
love is
oh,
so strong, you'll do anything for them. But when we look at
yes,
some of the great psychologists of the past, Carl Jung and Freud,
yes.
they talk so much about the devouring mother who won't let go of
Oh,
their kid and what happens when the mother keeps them. I have cousins that will probably never watch this podcast because they need it so bad. But they will never leave their mother's basement or very like a block away because they
yeah,
are entangled in this codependent
yes,
loop that keeps them all in addiction and all unhappy.
yes.
And it's so
I
painful to
know.
witness.
And it's so hard. I mean, even Al-Anon, and I'm sure some of your audience will be Al-Anon people. I loved Al-Anon because the
Yeah.
message was keep the focus on me.
Yeah.
But I'll tell you what was super hard. And this is because I'm an addict. It was super hard to see people stay with active alcoholics or addicts and not set a limit and not ask them to leave or not say you need to go to treatment because
Mm.
I know that's not the message of Al Anon, but at the
Mm.
same time, if I'm being codependent and I'm not engaging, I'm still enabling them to stay
Mm.
sick. So, I mean, I
Absolutely.
would get activated sometimes at a meeting because I'd be like, my father stayed with my mother forever because he was afraid to let her go. And
Mm.
yet, I'm not saying like he's responsible for her sobriety, but they don't have a chance if you
Mm.
don't start asking for what you need. So I don't know. I don't know
Oh,
what your
sure.
feelings are about
Oh, no,
it.
I agree fully. And even with my own mother and father, who could really use this podcast too and won't watch it, they have been really caught in a codependent web. They love each other, there's no question. But my
Yes,
dad has let my mom continue with these
yes,
narcissistic traits and patterns, and he hasn't
yes,
corrected her or stood up for his rights because
yeah,
he's always walking eggshells and not wanting to upset her, and he loves her.
yes.
And as a result, my dad hasn't grown and my mom hasn't grown. And here they are, almost 90, and they've spent 90 years on the planet struggling with the same things out of
I
fear.
know.
And it's
Yeah.
it's sad, you know?
I know it is. It's so sad. And like there are situations where literally like I remember when my mother was asked, what's the hardest thing you've ever done? And she said, staying married for 42 years because my father was an angry codependent. So he was acting out in other ways. And yet
Mm,
she was the alcoholic. And I think,
mm.
why would you stay? And yet I do believe people do the best they can.
Yeah.
And especially if they're of another generation. But I know people in meetings right now that are married to active people and stay stuck. And again, I can, if I have a relationship with them and they ask for my help, I can make suggestions. But I also know I cannot control anybody's recovery. I mean, they've got to figure it out, so it
Absolutely.
is sad to see. But yeah,
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 it is sad, but on the other extreme, as we see how we've moved away from those patterns, it gives
yes,
us some perspective. Oh my gosh, well, at
yes,
least in my life, I've been able to do this and walk away and shut some doors. And as
yes,
a result, I'm happier now. But what are the first
yes.
steps somebody can take if they want to move from unconscious codependent relationships into more self-awareness and healthier boundaries?
Yeah. I mean, I think like you did the exercise in the beginning of this podcast, I mean, the first step is being willing to pause. You know what
Mm.
I mean? I mean, I think just like with addiction, where it's like I'm preoccupied with drugs or alcohol, codependency
Mm.
is the same way, except it's a person. So, codependency, I am going to be preoccupied with what my husband's doing, what my boss is doing, what my child's doing, because I can't tolerate what's happening from me. So,
Mm.
if people can start to just disentangle a little bit and start noticing, pausing, whether they're in a conversation, whether they're about to do a certain automatic behavior. Obviously, getting support and some kind of, there's so much support online right now,
Yeah.
but really, it is just stopping. And I always say
Mm.
it's identifying and experiencing and expressing your feelings. I mean, most people, whenever a sponsee says, "Oh, I got sober so late," I say to them, most people live and die not having any awareness that they're
Mm.
being driven by their past. So
Mm.
even if you start looking at it when you're in your 60s or 70s, you're starting to get a chance at a more authentic, more rewarding life. So
Absolutely.
pausing, yeah, starting to identify feeling states. I mean, I have people put a little timer on their watch so they can start checking in with themselves,
Mm.
not with the other person, not with how your child is feeling. How are you feeling? What state are, and so it's really getting slower in your life and starting to look at, what am I getting out of some of these things? Like some people love chaos or drama or
Mm.
busyness
Mm.
because, again, it keeps their minds and their feeling states occupied. You have to be willing to slow down and stop a little bit. And
Absolutely.
it's looking at, sorry, it's identifying what behaviors are not working. Like you have to
Mm.
identify the problem also. What am
Mm.
I doing that's not working? Am I acting out in
Mm.
anger all the time? Am I anxious all the time?
Mm.
Can I never be alone?
Mm.
Do I always say yes when I don't want to say yes? Like really identifying specifically what is not working in relationships. Yeah.
Yeah, it's so true. Like, I think when I was in my various addictions, they
Yes.
kept me in such states of anxiety that I didn't
Yes.
have to look at the pain and the trauma that was underneath that. And the anxiety was just so strong that everything else
Yes.
was kind of buried. And I could never say
Yes.
no.
Yes.
No brings on a whole lot of feelings. Why is it that 1.5, 2 year olds, the first word, no, no, they step into that for a reason. It's a sense of autonomy, but often we're not allowed to say no.
Right.
So you are great in your book. You emphasize clarity and communication, like no is a complete sentence. I love that.
Right.
I love that expression.
Right.
Why is this
Right.
so transformative, and how can people practice this without guilt?
Well, that's a great question. I mean, I don't know if you know the psychiatrist, I think his name's Henry Cloud, Cloud and Townsend. They are these two guys that they're Christian psychologists and psychiatrists, and they wrote a book on boundaries years ago. And
Mm.
they've done a lot of boundaries with kids, boundaries with dating, boundaries. And I remember one of the quotes in that book said, if you are starting to feel guilty, it means that you're starting to set some boundaries. So it
Mm.
actually is a good sign.
Mm.
And it's something to start looking at. And kind of, I do like reality checks. Okay, so I just told my child that he can't use my car because he, I don't know, didn't fill it with gas last time. And now I'm feeling guilty. What's the truth? What's the reality? The
Mm.
reality is, I'm giving him a consequence. The
Mm.
truth is, he needs it. So
Mm.
the guilt is just an old pattern of a feeling state.
Mm.
And it's really just doing a reality check, calling a friend. I do reality checks with friends all the time. Geez, I'm thinking that I've gained 10 pounds, but the scale looks, or whatever it is.
Yeah.
Do you know what I
Yeah.
mean? Reality checks really help. And I mean, it's so empowering because I'll just say a little bit about the fear part is just like with addiction, I think fear and shame and anger and all kinds of things are underneath addiction. It's the same with codependency. The fear of abandonment, right? The fear of not being loved, the fear of not being liked, the fear of someone getting mad at me, the fear of rejection. All
Mm.
these fears are operating, but we don't know it. So it's
Mm.
really looking at, geez, if I'm not able to do a certain behavior, or I'm not willing to feel a certain feeling, what am I really afraid of? And
Mm.
is that fear from the past? It's really not happening now.
Mm.
And I think I say in the book, supposedly, and I don't know if the internet's right around this, says that we're born with two specific fears: fear of falling and fear of loud noises.
Right.
All the rest of those interpersonal fears were created from experience.
Mm.
And that's the tragic part too, is I may have had one experience in fifth grade with a boy that rejected me, but now I'm living out from that fear for the rest of my life. And unless you
Exactly.
identify it, you don't know that. Yeah.
Yeah, yeah, that's so beautiful. Sometimes in my work in somatic healing work, I've helped people to just sit in a visualization with somebody in another chair, for example,
Yes.
where they say
Yes.
no to the person, where they set a boundary, and then I help them to sit with the feeling that creates in
Yes.
their body. And a lot
Rich.
of
Yeah.
times that's it. It's so terrifying for them to do it, but if they just imagine it and do it over and over again,
Yes.
that helps them because this no is terrifying to those of us when
Yes.
we want love because all these
Yes.
behaviors are trauma responses to stuff that went
Yes.
down in the past where we might have been so young we don't even remember
Yes.
why we're doing it anymore. What are
Yes.
some of the,
Yes.
to just jump into the whole soothing end of it, what are some of the self-soothing or grounding tools that you found effective for tolerating emotional discomfort, perhaps without numbing, you know?
Yeah, I mean, you probably have more tools than I do. I mean, it's interesting because, of course, addicts, you know, use all kinds of things outside of themselves to soothe,
Sure.
right? Now, there are some things, obviously, that, in the somatic world, we can use, obviously, like if you have a blanket or something calming and soothing, if you focus on your feet, grounding techniques, identifying things in the room. And for me, it's really just like you're doing and talking about. It's identifying, geez, I'm in some kind of, fight, flight, or freeze fawning thing. I go into shutdown. So that's my thing.
Mm,
I freeze.
mm,
So if that starts to happen, I will talk to myself in a gentle way, and I'll just calm myself by validating that I'm safe, because it's all about safety, right? We
mm.
want to feel safe. It's always
Absolutely.
about safety. So again,
Yeah,
I'll do a reality check. Am I safe, or is this just a bodily response?
that's
And
great.
kind of getting that spaciousness. And this is interesting because now I remembered the second thing that was
Nice.
the most significant thing: studying Buddhism and
Mm,
reading a lot of Buddhism, because that idea that we are not our thoughts
mm,
and we are not our feelings, and
mm.
we are not our bodies ultimately,
Mm-hmm.
really gave me a lot of spaciousness with my thinking. So if I get activated, or I triggered, or whatever you want to call it, or I feel unsafe, I can do a lot of work around, oh, that's just my thinking. And then it's the work with the body about how to calm my body. I mean, there's tons of things people can do, and whatever works for you is what I would do. I
Beautiful.
mean, yeah, yeah. I
Yeah,
mean,
I love that.
I'm a big exerciser. I'm a big, getting cozy on my couch with my blankets and watching a show that I love. Like, I have definitely my ways I can feel safe again.
Mm,
Um, Being in my car. So, like, again, everybody's different.
yeah,
Do
yeah,
what works for you and figure out what makes you feel safe.
yeah.
Yeah,
That's beautiful. I love that.
yeah.
Identity is often caught up into these codependent roles, old patterns of reaction, people pleasing. We think we're the nice person, we're the one that gives a little more, we're the angry person, we're the one who flips out. How do people reclaim their identity? Now, I think this taps a little bit into what you're just sharing about Buddhism, because as we become more quiet with our different
Yeah,
practices of grounding, we start to realize we are more than our thoughts. We are
yeah,
more than our body. Um, and I'm a long-term meditator, so I've come to find that. And even in like a lot of wisdom traditions, they talk about this
yes,
Buddhism a lot, the Course in Miracles a lot, like
yes.
getting out of some of these patterns. But what would be some of your tips for helping people to reclaim their identity when they come and see you and they're so caught in all these patterns of thinking that's ultimately all they are?
Right. Right. I mean, I think identifying with people, I think framing it in a way of survival helps
Mm,
people to see that all of these things are just a way I've coped. So
mm,
I saw a girl recently, a younger woman who, said that she was diagnosed with oppositional defiant disorder when she was young.
wow.
And her identity was just anger. And,
Mm,
she ended up becoming an alcoholic and an addict and all that stuff. And we ended up talking about that. Like, what are you, if you gave that up, like, what are you afraid you'd get in touch with? Like, it
mm,
is just an identity. We are
mhm,
so much more than just one piece, our
mm,
anger or anxiety. I mean, the whole DSM and the diagnoses, part of the trouble is people get very attached to their diagnoses and their identities. You're right. And
mm,
I think just talking about the benefits, like when we can let go of that armor and identify that we've just been using it for a long time and it's a way we've survived and there's actually a different way, I think our anxiety goes down, our depression goes down, our somatic
mm,
issues go down. We have
mm,
more calmness, we are more free. Like I always think of self-expression. I mean,
mm,
people that are just very repressed and not self-expressed.
mm,
Your self-expression expands. Your ability to move expands. I mean, your relationships will help. Your ability to communicate will improve. I mean, there are so many benefits to
mm,
become, we call it come home to ourselves, right?
mm,
Letting go of all these strategies and safety nets and behaviors that kept us safe and
mm,
really just discovering who we really are. And that
mm.
takes time. I mean, I remember
It
when I
does.
got sober. Yeah,
Oh man, I totally relate to this. I still really struggled with my eating disorder when I first started
yes,
meditating. And even for many years, like sometimes I'd come off the meditation cushion and I'd go right to the ice cream or something
yeah,
because it would bring up the feelings. And it took a long time for me to just sit with the angst and all these
yes,
emotions and the shame. And actually,
yes.
also doing an ayahuasca ceremony, a bunch of ayahuasca
Wow,
ceremonies in the Amazon, helped me to go really deep into this shame bubble and just hold
got it.
myself because I'd done decades at that point of personal growth work,
Yes.
healing, meditation, and just feel. And it felt like I was drowning in emotional pain, emotional, physical pain.
Wow.
It was all the times I was, just left. I was born a year after twins to a highly narcissist, and you imagine my dad an alcoholic,
Invisible.
and
Yeah,
so none of that early stuff. And I was able at that point just to, and the biggest gift that came out is just a gift to be able to be fully authentic because
yes,
it no longer mattered what people thought of me, but
right,
what a
right.
journey it was of
Oh
decades
my
to get
God.
there. And it it
Yes,
it really,
yes,
that gift of being able to accept ourselves as we are,
right,
you know?
right. I know that's so huge. I'm fascinated by that. Well, you are a real seeker and an
Yeah.
adventurer.
Mm.
Yeah,
Well, I
I've
struggled with
heard about the
ang
ayahuasca.
Yeah, I had struggled with dysthymia my whole life. And
Yes,
that really is what brought me to that because I'd be great a lot of the time, always held jobs, functioned, but under the surface, I carried this gray rain cloud, much
yes,
worse in the winters, like through seasonal
yes.
affective disorder. But after that whole Peru experience,
Wow,
it was amazing. But all these patterns of distraction and doing this, it's so easy to do those. But when you're lying flat and you can't get up and you can't stop feeling the intense emotions for 8 hours at a shot on every ceremony, you just go into layers and layers and layers. So
wow.
it was a big thing.
It
But
sounds like, I mean, talk about confronting yourself. Wow.
Yeah. Yeah. I know a lot of people in recovery, the twins, a year older than me, they're both like 30, 35 years sober now and clean. And they would not go anywhere near this because they believe it's not in alignment with AA and, doing these things, but it's really different from partying
Yes.
or whatever. It's not even
Right,
like
of course.
MDMA where you might just feel, oh, heart opened. It's
Right,
it's going
right.
into the throes of the deepest
Yes,
trauma. So
I've heard that. Well, Gabor Mate talks about it because
Gabor
he
has
went
become a
on.
friend of
Yeah.
mine. He recommended for me where to go in Peru. That's how I ended
Oh,
up
that's
going.
wild. Okay, good.
Yeah,
Yeah, because I've heard
yeah,
him talk about it.
yeah,
Wow.
yeah, yeah.
Wow.
That was
Fascinating.
it is, and it
It's
and it
whatever
helps.
works, whatever you feel like you need.
whatever
Yeah.
whatever you need. And
Yes.
I had been following Gabor for a lot of years with other things, addiction and saying no and the body
Yes.
pain and the
Yes.
this and that. So it
Yes.
was it was perfect at that
Yes.
time. So
Wow.
anyway, getting
Good
back
for
into
you.
Thank you. It certainly helped me at that time. That was like 12 years ago, and it just kind of helped me jump into another whole layer,
Right.
which is why I went
Right.
more into the somatic work and whatnot that I've been
Yes.
doing now. So it's
Yeah.
great. Let's talk a little bit about the role of forgiveness of oneself and others. How does forgiveness create freedom instead of shame? Do you see if you talk about the shame spiral, and I just wonder about the role of forgiveness in recovery
Yeah,
and
I mean, I definitely have a certain view of this. I mean, you will get different answers from lots of people. Many people
sure.
are like, you don't have to, it's not necessary. For me to be free, and I talk about freedom a lot,
Hmm.
I need to make sure I'm not holding on to past resentments, past, rage at people, blaming. All that stuff can be so dangerous for someone who is an addict or
Hmm.
just someone in general. I mean, yeah, I might feel like it might come out with me as a craving or something, not now, but for other people, I still believe it takes away people's spirits. So I do think, I mean, part of doing the fourth step in AA, writing out all my resentments, writing out my fears, writing out my sexual history, and being in therapy on and off for years,
Yeah.
I've really gotten to a place of what am I holding on to? If I
Hmm.
believe that someone, I really do believe this, that everybody's doing the best they can and did
Hmm.
the best they can,
Hmm.
then it's not about the other people and it's not
Hmm.
personal. I mean, that's
Hmm.
definitely an Al-Anon. What someone else is doing, and this is really hard for people to get, what's happening in their hula hoop, even if they're saying something to me that's hurtful, it's not about me. It's
Hmm.
about what's going on with them.
Hmm.
So I definitely believe, I mean, I can honestly say, after going through the steps a bunch of time and doing my own work, I am what I call complete with everybody. If I died tomorrow, I wouldn't have some harboring resentment at someone. And I remember during COVID, I got involved in a meeting online, and the ninth step of AA is about making amends. And I realized that I hadn't made amends to my second husband, and he was deceased, but he had relapsed, and my life had become a shit show. And I thought to myself, I was working with someone, a sponsor, and I said, I really want to do this. And I ended up having this amazing experience writing out my amends and working through my resentments. And I drove up to Maine and I went to this beach where we used to go.
Wow.
And I made the amends on this beach. And what is so wild, I don't know if you believe in like God or the spirit or whatever, but when I got to that
Absolutely.
beach, it was early in the morning, and there was a man getting out of his car, and I said hi to him, and he was going down to the beach and I was going down. And I went down, I did the amends, I had all my feelings. And when I came back to my car, that same man was walking back to his car. And he started chatting with me. And I said, hey. And then I was just about to leave. And I said, where are you from? And he said, Freedom. And I said, Freedom? And there's a town, Freedom, New Hampshire. And
Wow.
my husband was from New Hampshire. And I just felt like
Oh.
that was like this message from the universe, like that was your last one and you did it and you can be free.
Mm.
And it's hard for folks because they think people don't get that forgiveness is about our freedom. It's not
Mm.
about letting the
Mm.
other person be free.
Absolutely.
Most of
Absolutely.
the time
Oh
they're not
man.
even thinking about it, right?
Absolutely. And shame is also too when we feel bad
Yes.
about who we are. So that's a really
Yes.
big part of it. Like a lot of times with the whole forgiveness piece, if somebody can't come to forgiveness, there's some feelings they haven't felt. What responsibility can they take to sit and write about this and hold themselves in it? Because once they've freed that part of
Yes.
shame that they're clinging to, relating to whatever, the forgiveness is almost a natural part of itself. As we do so
Yes.
many, we never, some people we never have to really forgive. It just happens because we grow and we
Yes.
feel and we heal those things.
Yes. I mean, I think the biggest part of one of the steps of AA when we write out resentments and amends
Mm,
is forgiving ourselves. So
mm,
I had to do a process of writing out what I called resentments towards myself
mm,
about behaviors I had done. And so there was this writing process I did, having those resentments towards myself, and then really seeing that I need to write and get clear and forgive myself and remember I was doing the best I could. At
mm,
whatever age I was at that time, I was doing the best I can. So it's letting go of our own prison that we're keeping ourselves in. And I think people like, it's funny. I just did one more podcast with Emma, the Therapy in a Nutshell woman. You can look up, and I think the title is Freedom. And we talk about repairs and amends and making repairs and the importance of it. And it was funny because she said, like, there's no part of therapy where like people do that. Like it's so
mm,
much easier to blame someone else or to, focus on what they did to you, but it's much harder to acknowledge and be with the things you've done. And
mm.
that's really where the freedom is. So, yeah.
Absolutely. Where
Yeah.
all the freedom, all the growth, for sure.
Yes.
Yeah.
Yes.
And when you might be in a relationship and you're seeing those things because you're looking at them and you're doing your writing or recognizing, oh man, this is my part. Um, how do you take that on without taking on all of the blame and
Yeah.
still stay, honoring of self and hoping,
Right.
the other person might
Right.
say, I've got a part in this too.
Yeah, I mean, in the big book of AA, they talk about putting the person in the category of the spiritually sick and looking at your own behavior. I mean,
Mm,
I think the thing that I know is if I'm focused on blaming someone else, I'm not going to heal because I can't change someone else or what they've done. I can only change myself.
right,
So
right.
again, it's seeing it from kind of a reality point of view. I mean, most things involve both people. Do you know
Yeah,
what I mean?
yeah.
And there were things that I did as a drug addict, there were things that I did in sobriety. You know
Mm,
what I mean? So, I mean, in sobriety are the things that are much harder. But again, it's like, it's really trying to see it in a realistic way. I mean, the all or nothing thinking, the
uh,
staying in the shame, the staying in the blame, it's all drama and it's all either or. Nobody is just, I mean, again, it's about our freedom.
mm,
And if I want to be free, I got to work, I got to let some of that go. Um,
absolutely.
and we make mistakes. I mean, my
Yeah.
gosh, have I done a bunch of things that I wish I didn't do? Absolutely. But if I stay stuck in that, I'm not going to be of service to other people.
Oh,
So,
for
yeah.
sure. I love that.
Yeah.
Wow. Yeah. Well,
Oh,
that's so true. That's so true.
yes.
For our
Yes.
listeners who might feel stuck in cycles of codependency, and this might be bringing up even more, or cycles of addiction, what's one step they could take today that might help shift their patterns?
Mm,
Somebody just
yeah.
starting out maybe and going ding, 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 all the
Yeah.
bells
I
are
mean,
going.
yeah. I mean, I would seek out help. I mean, if you're identifying some patterns that aren't working. I mean, there's so many like websites. There's Al-Anon, there's Codependency Anonymous, there's plenty of psychologists. I have a YouTube channel. There's, you can listen to some podcasts. I mean, codependency is all over the internet now. So, I
Mm,
mean, you definitely can get help. I think part of the issue is people don't even know what codependency is because the word's so overused and it's been
mm,
around for so many
mm.
years and it's evolved from like an alcoholic, a female housewife being married to a male alcoholic, which was when it began, to now it's like, you don't even need to be with an addict to be codependent. So, I think like anything, if you're struggling with something, definitely seek out some help and try to find somebody that knows more than you do about the topic. And
Yeah.
I think it's the willingness to be honest with yourself,
Mm.
and remember that, my God, especially these days, everybody's getting help. So
Oh,
have
man.
some compassion for yourself. Yeah.
Absolutely. I think
Yeah.
a great starting zone for people that are watching this and see themselves in this would be your book, because I'm just going to
Sure.
mention some of the chapters. You've got what codependency really is in your intro. You've got the illusion of niceness. You've got saying
Yeah.
no without apology. These are all chapters and so important.
Yes.
Language and clarity, talking truthfully, feelings, naming and tolerating. I mean, it's just epic, the
Yeah.
areas you
Yeah.
cover. Awareness of old wounds, boundaries as compassion,
Yes.
shame and
Yeah.
self-compassion, compassion for self. That's so beautiful. Responsibility without self-blame, identity beyond reaction, daily practice and real-world change, and forgiveness, freedom, and new narrative. So that is your book. You nailed it. And I
Thank
just
you,
and
Janetta.
and I
Thank you.
love your podcast with Finn is so fun. Leaving
Thank you.
Crazy Town.
Thank
People
you.
can plug in while they're cooking or whatever and just kind of hear some real life examples, which you guys use so much humor and storytelling, and I love that.
Right.
How does
Yeah.
even a
You
question
try
out
to
of
have
that?
some fun.
It is
Well, because
fun.
this can get very heavy and intense. And
Oh,
after listening to people for 30
absolutely.
years, it's like you want to have some lightness and some joy at the same time where you can resolve your stuff. It
For
doesn't
sure.
all have to be, it's so easy to get stuck in the pain.
Yeah.
And to remember it's a process. And,
Yeah.
we're all working on it. And yeah, yeah.
So
So thank you for
with
having me.
of course, it's wonderful.
Yes,
Maybe one last question would be, how do you help
sure.
your clients to stay connected to joy in the midst of hard emotional work?
Yeah. I mean, I think it's so important. It's funny because I've been really focused on joy since I kind of semi-retired because it was a
Yeah.
huge transition to go from working full time. And then suddenly I'm like, what am I going to do? And I wrote the book and I got this
Wonderful.
little channel. So the focus on joy is so important. And I'm constantly making lists of what brings me joy from big
Mm,
things to
mm.
really daily things. And
Oh,
I'm sure
beautiful.
you've heard this too, like gratitude, being grateful is the one thing that can change your attitude in a minute. So I'm
Absolutely.
always making gratitude lists. And when I hike, I try to go through the alphabet and talk, and think of like things I'm grateful for, starting with A to Z. So
Oh, I love it.
shifting your attitude. I mean, you can go through a hard time and still have a good attitude and some joy. It's
It's
not
massive.
all or nothing. Yes.
Absolutely.
Yeah.
Absolutely. Well, we're going to be closing in shortly, but I just have maybe looking back on your journey, what do you wish you could tell your younger self about healing boundaries and self-respect?
Yeah. I mean, I would tell my younger self that I'm not responsible for everybody else. I'm just responsible for me. I
Yeah.
mean, that's such a biggie because I think so many people growing up and like if their parents are depressed or alcoholics or whatever, they just feel that over responsibility for everyone
Mm.
and just pulling it back. And that is the thing that happens with codependency recovery is life gets way easier. I mean, my life is so simple and easy because I'm not preoccupied with all of these other people's problems because I know that
Mm.
it's not my job. So
Oh, beautiful.
really just, getting out of other people's business and yeah, and just focusing more on joy and fun. It's so funny because my son is hilarious. And I remember him coming home from school one day and saying, God, school just isn't fun lately. And I'm like, yeah, I get it. It's not supposed to be fun. But like
Yeah.
his whole
Yeah.
thing was life is supposed to be fun. And,
Yeah.
really I mean, and especially these days, I mean, I just think the
Oh,
whole country is codependent.
yeah.
Everybody's reacting, everybody's angry, everybody's preoccupied with what someone else thinks and feels. I mean, we need to just get back to focusing on ourselves and our own happiness and peace. I mean, wow.
For sure.
Another
And that's
podcast.
exactly it. They're trying to change the other side. It's all this codependent patterns out there. And it's long been said that when we stop focusing out there and we heal ourselves, there's a lot of spiritual quotes along these lines that the whole
Yes.
world heals. Everything takes care of itself
Yes.
when we do the clearing out. So,
Yes.
Sarah, thank you so much. I'm going to do a couple of little closing words to wrap up that I
Okay.
wrote.
Go right ahead.
Thank you, Sarah, for sharing your story, your wisdom, and your practical insights today. For our listeners, recovery and self-awareness is not linear. It's not about perfection. It's about showing up, noticing your patterns, and practicing compassion for yourself along the way. May we all leave here a little lighter, a little clearer, and a little more courageous in claiming our own lives. Thank you so much, Sarah, for
So
today.
beautiful. Thank you.